This is Central Blood Bank of Nepal. Nepal Hemophilia Society was established in 1992 and got affiliated with the World Federation of Hemophilia. In the very initial stage, there were only 25 to 30 patients with hemophiliacs, and Dr. Ranjan Prasad Singh, the father of Nepal Hemophilia Society, was director of blood bank at that time, also the current president of Nepal Hemophilia Society right now. He permitted the patient with hemophiliacs to get plasma transfusion on the beds of blood bank on his own risk and personal permission, because there were no other place for hemophiliacs to get treatment in Nepal, all over the country. He also get together all the hemophiliacs and guardians and encouraged them to establish a society. All the members were allowed by him to hold regular meetings at the library room of blood bank at that time. That's how Nepal Hemophilia Society came into existence. This is the biggest hospital of Nepal, Bir Hospital. Here, Nepal Hemophilia Society anyhow succeeded to occupy one room. There we are running a care unit, Nepal Hemophilia Society care unit. So here we have the one nurse, her son is also hemophilic. She is taking care of hemophiliacs, and all the hemophiliacs, they come here to get treatment, mostly plasma, cryo, because in the lack of factor concentrates, which only used in serious cases such as surgery cases or hemorrhage or some other operation cases. Mostly treatment is dependent on plasma and cryo. Collection of factor concentrates are mainly dependent on the donations from various resources such as World Federation of Hemophilia and FBIS and some other resources, but they are not guaranteed, and they are not guaranteed that they come in numbers and regularly. Hence, in the lack of required treatment or required number of factor concentrates, we are losing almost 10 hemophiliacs every year. Somehow, this treatment center has been providing best treatment according to the limited resources and limited facilities it has got. As we all know, treating hemophilia is very expensive. Some of our hemophiliacs fathers has abandoned their mothers along with the hemophilic children, and some of our hemophiliacs father, they have suicided, and some of hemophilics families after treating regularly to the child, they have become bankrupt. They have no money left now in neither the lands.
In 1978, when I came from Australia having a master's degree in hematology. Since then, persons with hemophilia, they started turning up at the blood bank, and they are getting the plasma and sort of treatment in the blood bank. At that time, there was no medical facilities in any hospital was available for the treatment of persons of hemophilia. Since that time, we have progressed a lot. Now those who were children, small, 8 or 7 years old, now they have grown up and they are getting the medical facilities. And we have got now a central office, and then we have got 5 branches, and as well as we have got at 2 hospitals, there is a hemophilia care unit. If we look backwards, remarkable achievements has been done in the field of hemophilia.
And there are few major problems hemophiliacs have to face in this country: to get comprehensive treatment, to get education, to get employment, to get married, and to get social respect, and have not getting not only human rights but disabled rights also in Nepal. Bearing physical pain, not only with physical disability, but also they have to bear mental problem, and they are suffering from pressure and mental depression as well. Hemophiliacs in Nepal always have fear of expiring anytime. Not only expiring fear, but they also have, in the lack of sufficient treatment, they have becoming permanent disability. such as hand joints and leg joints are permanently turned disabled. The most of young hemophiliacs, like 25-30 years old, you can say more than 50% has already turned in permanent disabilities, and other hemophiliacs are turning slowly in the lack of factor concentrants and enough sufficient treatment.
Besides these, we always get moral support from the Hemophilia Society of Sweden, and every time whenever we had crisis, we look towards them, and always they come forward with very good support and suggestions. At this point, I would like to thank them and individual persons who are involved in helping the hemophilia patients in Nepal. Thank you.
Nepal Hemophilia Society is a only one organization to provide treatment for Nepali PWS, and it has great challenges to provide treatment for all PWS of Nepal. So we are going to establish a college, P-Pharmacy College. About that, my colleagues explore on it.
My name is Asif Khan. I am also a hemophilic patient. So we have held a long discussion and research in our society along with all members and the guardians. So we have come to a conclusion that it will be very good if we can open a D Pharmacy college along with B Pharmacy to get ourselves independent, because unless we have no choice, otherwise we have to depend on the help all the time. Unless we will do some income generating program or project, we cannot be independent by ourselves. And because our disease is costable, it is expensive to treat all the time, so at least we have to become independent. So this is our desire, to open a B Pharmacy college along with D Pharmacy. So I would like to appeal all of you, every individual, every pharmaceutical companies or business organizations or every social organization of this great country of Sweden who are already helping us, to please think about this and help us as much as you can, so that we can become independent by our own. Thank you very much.